This is the Amazing Education Podcast. Powered by the Ames Community School District, I'm your host, Eric Smith. On today's episode, we're joined by Health Services Supervisor of Ames Public Schools, Dr. Kathi Arnold. We're going to have an amazing conversation about the differences between last year and this year related to COVID-19, key mitigation strategies, and what parents can expect for communication. Dr. Kathi Arnold, thank you for being on this episode of the Amazing Education Podcast. How are you?
I'm doing okay.
So I feel like so we're going to talk COVID today, COVID in schools. I know, it's something that we need to talk about, and it's just weird because, we ended last school year thinking we were at least somewhat on a trajectory where maybe this wouldn't be as intense of a conversation and talking points within our district. And then, the summer happened, and now leading into school, we are officially in school now, but leading into school, we're talking about it again. And
I will say it was a surprise, a little bit. We had, even up to mid-July, been thinking, okay, we of course had plans, but we're probably anticipating a little bit different of a take, a little less intense focus, but mid-July we started seeing that increase in cases due to Delta, and so here we are looking at it again.
Yeah, we absolutely are. And, it's not just a conversation in our district. It's a conversation that's, happening across Iowa and across the United States. You just referenced it, but with the Delta variant. So here we are. We do have actually a lot of things that I want to talk about today. So maybe I'll just kind of quickly outline some of those. We are going to talk about just some mitigation strategies. We're going to talk about what our specific communication strategy is related to COVID. I know that some parents, probably already know what it is. We shared some things on our website, but I think it'd be good just to kind of talk through what that looks like, testing, and then our dashboard as well. So I think maybe we just jump right into it.
Sounds great.
All right. So this year in Iowa, as many of our parents and community members know, although we are continuing to talk about, COVID-19 and how it impacts our schools, schooling does look a little bit different this year than what it did last year. So a lot of the conversations that we had throughout the year last year were about delivery models. Should we be online? Should we be in hybrid? Should we in person? How do you make that decision to move in and out of those? And then the other conversation, at least early on, had to do with masks. Well, both of those topics are things that, right or wrong, like it or don't like it, we do actually have clarity on. So just to outline for whoever is listening, back in May, there was an Iowa law that was passed that said that school districts could not issue a mask mandate. Correct. And then additionally, we are also required to provide in-person instruction. So kind of two of our big things that we really worked out last year as far as talking them through both internally at school board meetings. You are an active participant in our school board meetings. They're less of conversations this year. But let's jump into masking. So we are on the record, and we're continuing to encourage the use of masks. So talk us through a couple of, why are we saying that as a district?
Sure. Well, a couple reasons. First, we know that we have a fair percentage of our staff vaccinated, and we're still asking them to strongly consider wearing a mask. Part of that is some of the research that's come out that even if you are fully vaccinated, there are breakthrough cases, and you do have an ability to spread that to others. Vaccines are doing an awesome job on trying to protect people from hospitalizations and deaths, so vaccination is still working. It's doing what it's supposed to do. But with Delta, that breakthrough really increases. Delta as itself is something that is spread more easily, a little more virulent, and that so we're making sure that for those who are vaccinated, we still want them to wear masks, and especially for those who are unvaccinated, we want them to wear masks too, because those layers of protection, it's one of those strategies you talked about, like those layers of mitigation and what we can and can't do. That's one thing that we would encourage people to do.
So last year at this time in August, COVID was still relatively new for us. I mean, March of 2020 is when everything kind of kicked up in Iowa. They closed schools, and then we got into this summer, and we were really planning our return to learn. But then even as a community across the United States, we were still learning sort of like about the coronavirus and what were best practices. Talk to me a little bit about masking, and I know you did some already, but kind of like situational masking. So, outdoors, large groups, indoors. Talk through that.
Sure. So with masking, just in general, the concept of masks, of course, are going to protect. If you're positive for COVID, that provides a great protection. Even a cloth mask will provide some protection against that being spread. It also protects the wearer to some extent. Now, the bigger protection is on if I'm positive and I wear a mask, but there is a layer. Studies have shown that there is protection for the wearer as well. Of course, we want people to be wearing masks that are well fitted, that are fitting on their face, not under their nose, to do that. So in that, you were thinking about that when you spoke of outdoors, large gatherings. Outdoors is safer. Now, if you were, and that is probably a place where if you're going to take a mask off to take a mask break, outdoors is a better place to do that. When we're thinking of recess or those areas where kids might be really clustered, maybe they're all on a piece of playground equipment, maybe masks are a good idea there because they're in that close contact with each other. But if we're running and playing tag, they're not going to be close, and so it's a balance. It's hard. It's those shades of gray. I think also when you're looking at large outdoor gatherings, like let's say you were at a picnic and had a whole bunch of people under one of the enclosures, while the sides may be open, if you're really close in contact, again, that might be a place where I might want to wear a mask. Yeah. Outdoors does do a great job though to help dissipate the droplets, but. Yeah.
Well, I appreciate a word that you said, it's a balance. I know that, and I've talked with people as well, sometimes, especially outdoors, we're in August, it's Iowa, it's humid, it's hot. Sometimes they can be uncomfortable as well, but the word that really did resonate with me was the balance. And so, the mask, we're encouraging it. It's not perfect, but
it's a piece. It's a piece of that mitigation, right? So is it going to protect everything? Is that the be all end all for everything? No, but it's a piece. So it's thinking about those decisions, right? It's what are the different layers? That Swiss cheese model of mitigation. It can still get through, right? Piece of Swiss cheese still has holes. It's not perfect, but if you line up enough of them, maybe you're going to provide yourself some more protection.
So we just shared out on social media yesterday, and we're getting some posters made for our buildings as well. But there are some other and additional mitigation strategies as well. And actually, a lot of these make sense once we get into, like cold and flu season, we get into winter in Iowa. Wash hands. If you're sick, stay home. What else do you want to add?
Okay, I'm going to have to hit on that second one really heavily. Yeah. If you're sick, stay home. That's the best thing we can do is to try to prevent spread of anything, COVID especially, but colds, flus, other bugs that people may have. If your child is sick, if you yourself are sick, staying home contains that, right? With COVID, we know that people are... they can be infectious 2 days prior to when they start showing symptoms, but definitely when you have symptoms, it shouldn't be a question like, oh, I've got a new sore throat, I've got a cough, I've got a little bit of a fever. Should I go? No. Stay home. But definitely hand washing. Hand washing is good in general. Again, we're focused on COVID, right? If we're thinking of just health in general, you touch surfaces, you touch your cell phone, you touch all those things, and then if we touch to adjust our glasses or wipe our nose or wipe our mouth, you don't think about it. That is a way that you can get viruses and get other exposures. So hand washing is important. Again, is hand washing itself going to solve everything? No, but it's a piece to do.
Aren't there studies out there that say that our cell phone is one of the most disgusting things? And we all handle it every day. I got mine sitting here. We're all on it.
It is. I thought about saying that, and then I didn't want to scare people. But yeah, your cell phone, wipe your cell phone off. It's amazing. You think about it, it goes in your pocket, it goes on your car seat, it goes on strangers' desks.
Yeah, no, I know.
Lots of places. So that is the thing, and you're putting it right up by your face.
Yeah.
Now, with COVID-19, spread from what they call fomite transmission or from surfaces, not really seeing that as a high risk. But again, if we're talking about health in general
health, yes. No,
that's
I appreciate
important.
that. So with masks being optional yet encouraged in our buildings, and we are bringing, we have hundreds of students that are going into our buildings. And so it was essential that we continue to have a communication strategy for if and when, we do have COVID in our building. So when you and I kind of prepped a little bit for this episode, there's a 3-layer approach. So talk me through that. What will happen, what can parents expect if we do have a positive case in our buildings?
Sure. So what we're doing, and we've differentiated a little bit between our PK through 6th grade and then 7th through 12th grade. With our PK through 6, those are our students that we know are 12 or under, most likely under 12, so they don't have the option of getting vaccinated at this point. We hope that comes soon. So we're focusing on that group specifically of looking at still doing contact tracing. So that's where that you'll see the 3-level communication strategy. So if we got notified of a positive in a classroom, the first thing we're going to do is do some contact tracing. Now, we're doing our best job that we can with this. We are looking for those contacts that are within 6 feet for more than 15 continuous minutes. That might be through seating charts, that's talking through situations, trying to look and analyze that way. So what we do is then if a child's identified as a close contact, the parent receives communication that your child has been identified as a close contact. We then, in that PK through 5 classroom level, 6th grade is at a team level, communicate to the classroom. So there was a positive case in your classroom, however, your child, if your child was a close contact, you would have received an email indicating so. And then the 3rd layer is communicating at the building level. We are letting a building level know that there was a positive case in the school. We're trying to do the communication we can. We don't want to make people scared. That's not the goal. The goal is just to be as transparent in the communication as we can. Now, there are some provisions with that. We can't give out names, obviously. Yep. We have to protect people's confidentiality. And there are some limits to what we can share. So, but we want to make sure that we're keeping our parents and the families as informed as we can so they can make those decisions. Now, with the children who are close contacts, we've been advised that we can't mandate or require them to stay home. We cannot, as far as quarantine, what we provide them with is, your child has been a close contact. Here's what the CDC says. Yep. IDPH says that, we don't have to. You do not have to. This is a personal family choice. But we give them the dates. We give them some resources for testing so that they can make that decision and what's best for them and their health situation within their family.
Sure. So let me recap that. So
sure.
If I'm in a building, if I'm a parent, I could at the end of any particular day say that there was a case in the building. It doesn't necessarily mean that my student was around that student. It's just for transparency reasons, that is why. So that is one email I could get. Yeah. One that is a little bit closer is, okay, a student in my student's class had it. Or, right. Had COVID-19. And so, that's another layer. And then, but the first email I would get could be if my student was a close contact. So correct. That's the first one, building or classroom, then building.
And I understand that may result in a family getting 3 emails. We really looked through how we could do that and not make it confusing.
I know.
And make sure that we are, again, being transparent. So we're opting at this point on the side of unfortunately for some of those families, getting 3 emails. Yeah. But we want to make sure that's how important we think it is. We want to make sure that we're communicating that. And the other reason we're doing a classroom level, which we hadn't done in previous last year, was we know that we cannot require masks. Mm-hmm. While we strongly encourage them, we cannot require them. Yeah. Our teachers cannot then say which child was wearing a mask, which child wasn't
Sure.
wearing a mask. If they took it off, so it's really trying to make sure that we're letting them know at a classroom level that that there was someone in their room, and that's our plan as of now.
It's like a different layer of complexity this year than what it was last year. Just
Definitely
as complex, but just different.
Right, and so just to clarify, for our 7th through 12th graders, they would only be getting one email. They're only going to get a building level email. If you think about just how those 7th through 12th grade is set up, they have multiple classes with different people. There's different activities. It's a different situation, and we really are hoping that that population is taking advantage of the fact that they can be vaccinated and wear masks. Now, that's the plan as of now. And COVID's fluid.
That's the one thing I think both you and I learned last year is we can share what is accurate today. It doesn't mean that it's not going to change or be adjusted over the course of the school year. So I appreciate you bringing that up.
I think sometimes that's hard too, right? Like we want to say, here are the rules. This is it. We're done. But we know that things unfortunately have to change sometimes, and that sometimes leads to confusion. But I think that's, again, we try to communicate as much as we can. Here's the plan as of now.
So I always, I'm just going to give you a little bit of a shout out here first, because every time I ask you to participate in something, you always say yes. So whether it's this podcast, so thank you. But earlier this week, I asked, hey, do you want to do a news segment for KCCI? And of course, you said yes. And that segment was around a number of things, but one of the things that they did talk about was around testing. So do you want to talk a little bit about how we've applied to be a Test Iowa site, what that means? Will we have test kits available? Who can get access to those? All of those things.
So as far as testing, there's still a wide variety of tests available here. But again, this is something that we know is a little different than last year. We don't have the Test Iowa clinic sites where you went and actually got tested available. So there's still tests available from Story County Public Health, still from physician providers. There are still tests at drive-up pharmacies. And there are also rapid tests available. Those are over the counter. They're about $20, $25. You get 2 tests for a rapid test. You can purchase those at Walgreens, Walmart, lots of different places. The difference in what we're looking to offer, and we have applied to be a Test Iowa distribution site. So we're not doing testing on site. That's not something we've been given permission to do. As a school, what we're looking to do is make tests accessible to our families so that we would be able to give a test kit out to a family, to a student, with the parent's permission on if they were wanting to get tested. The goal would also be for staff, if we get approved to do so, that they would be able to pick up a test kit, no questions asked, to use.
Sure.
The reason that I really think that's important, and I really hope that that approval goes finally through, it's what we're seeking to do, is just, again, to give people easy access to testing. So if you're questioning, should I take a test? Well, now I've got to call my provider, or I've got to go somewhere. I want to really make that accessible and easy so that someone can come get it from the school nurse. We'll have them available here from the district office that I'm going to plan to distribute. Again, pending approval, but really to just get testing out there so that people aren't questioning, that they know, because it's better to do that. They're a mail-in test. It's a saliva test, so it's not the scrape your brain type that people fear. It's a saliva test. It does not hurt. And then it gets sent through the mail, and you get a result from the state hygienic lab.
Sure. So just for clarity, though, if, let's say, a student is in one of our buildings and has perhaps symptoms, we're not doing the testing. We would not administer the test onto the student. I mean, we would not make that decision for our parents. No,
and we're not permitted to do so, nor is that something that we would do do anyway. Anything that we would do is, of course, the goal is that these are parent requests, that they're interested in and they want testing. So again, it's facilitating testing and making it easier. It's not us testing anyone at this point.
Now, we don't have the tests available yet.
No.
But when we do, if a parent wanted to request one, how would they go about doing so?
So at this point, the process is will be to go through the school nurse.
Okay.
They're the ones who already deal with all those confidential health things.
Yep.
So it would be that, and if we were able to offer them also at the district office, it would be to go through through me.
Sure. No, that makes sense. So we keep updating our website.
Yes.
I know we had a conversation at the end of last year, not whether we should or should not have a dashboard, but whether that need would exist. Well, as we mentioned already, we go through this summer, and, we made the decision fairly early on that, we were going to have a dashboard. Mm-hmm. So it is available on our website. But what does it say? How is it maybe slightly different than last year? And then how is it being updated?
Sure. So, right at the end of school last year, the dashboard, we didn't have data for it, so that came down. Then we made the decision that it's a good thing. Again, transparency is our goal with this. Our dashboard looks a little different this year. We're sharing our positive cases by level. So we've got our PK through elementary, middle school, and high school in separate, and for students and staff. So that's the grid of what's shared from a positives. The reason we're not sharing quarantines or close contacts is it's not really reliable.
Sure.
Since we know that parents have the option to send or not send, it didn't feel like it was accurate data to share of those close contacts. So that is different this year. We're also not sharing the staff and students absence 5-day absence rate this year. It really didn't show us much, and we want to make sure that the data that we're providing the community is what they need.
Yeah.
Our dashboard also includes the local community transmission, and that is not updated daily like it was last year. Yeah. IDPH has changed their delivery model on data, and so that's updated on Wednesdays, so that would appear on our dashboard on Thursdays. Yeah. Our dashboard is updated on a daily basis in the morning, and so any changes would be, probably before 9 a.m.
Yeah, sure.
Yeah.
So our information that we control, we're updating daily in the morning. So anything that happens during the day, that'll be reflected the next day.
Yep.
And then just because of the community indicators, IDPH updates those once a week. Yep. So when we get that information, we'll update it as well. But it's not, necessarily reflective of the day before. It's just updated on we update ours on Thursday, and then
And now I will say, we are watching. CDC does update their data a little more frequently. Okay. We've decided to go with the IDPH data on the weekly basis because it's a consistent data methodology. It is something we do watch, though, on a daily basis to see if we're seeing anything. I am constantly in contact with our local public health as well. We have a very great relationship. So we communicate if they're seeing things. We are one of the, as of right now, we're one of the only counties where our public health is contacting people who are diagnosed as positive COVID. They're not doing contact tracing, but they are notifying and making sure that people are aware. I know that they're locally, some providers, if you have some comorbidities, you have other illnesses, along with COVID-19, there's antibodies that you might be able to receive. So they're really trying to make sure as a community that they're doing what they can too.
Yeah.
So.
Well, Dr. Arnold, I want to thank you. I think we did it. I mean, it's kind of a crash course. I know this episode, that's really what it was intended to be, but I think there is a lot of good information that, we want to find different ways to be able to communicate it. Sometimes reading an FAQ, although that's great, it doesn't always resonate with everyone. So I hope those who are interested in this episode found, these topics to be useful. And of course, they could change. So
subject to change, but the take-home message: get vaccinated if you're eligible, and please wear a mask indoors. Keep yourself safe.
There it is. Well, I don't know that I have anything more to add than that. So again, I want to thank you, Dr. Arnold, for being on this episode of the Amazing Education Podcast.
Thank you.